Every 2 seconds, someone in the world is diagnosed with cancer. Every year, nearly 10 million people lose their lives to this disease. It's the second leading cause of death globally, and the numbers are rising. But here's something most people don't know. According to the World Health Organization, approximately 40% of all cancers are preventable. Not treatable, not curable, but preventable. They never had to happen in the first place. 4 out of 10 cancer cases could be avoided through lifestyle changes, environmental improvements, and early detection. That's millions of lives that could be saved. In this video, I'm going to show you exactly which cancers are preventable, what causes them, and what you can do starting today to dramatically reduce your risk. This could be the most important information you hear all year. Let me start with some numbers that should make you pay attention. In 2023, there were about 20 million new cancer diagnoses. Cancer rates are exploding, especially among people under 50. It kills more people each year than HIV, tuberculosis, and malaria combined. The economic cost is staggering, over $1.5 trillion globally. But here's the key takeaway from all the data. When researchers analyzed all cancer cases, they found that 40% could have been prevented through known interventions. Things you can change, behaviors you can adjust, exposures you can avoid. The most common preventable cancers include lung cancer, which is 90% preventable by avoiding tobacco. Skin cancer, preventable with sun protection. Cervical cancer, preventable with a vaccine. And half of all colorectal cancer cases could be prevented with lifestyle changes and screening. Think about that. If we implemented everything we already know, we could prevent 4 million cancer cases every year. 4 million people who wouldn't have to go through chemotherapy, radiation, and all the suffering that comes with the diagnosis. So, why aren't we doing it? Let's break down the 5 biggest preventable causes. Number 1 is tobacco. It's the single largest preventable cause, responsible for 1 in every 4 cancer deaths. It doesn't just cause lung cancer, it increases the risk for at least 15 different types of cancer, including mouth, throat, bladder, and stomach. Smokers are up to 30 times more likely to get lung cancer. But here's the hopeful part. When you quit, your risk starts dropping immediately. Number 2 is diet and obesity. Poor diet and excess body weight are responsible for about 1/3 of preventable cancers. Obesity increases your risk for at least 13 different types, including breast and colorectal cancer. Processed meats like bacon and hot dogs are classified by the WHO as known carcinogens. On the other hand, diets rich in fruits, vegetables, and whole grains are strongly protective. Number 3 is alcohol. Even moderate drinking increases cancer risk. Alcohol is a definite carcinogen, causing about 6% of cancer deaths globally. It's linked to 7 types of cancer, including breast, liver, and colorectal. For breast cancer, each daily drink increases risk by up to 10%. There's no completely safe level of alcohol consumption when it comes to cancer risk. Number 4 is infections. About 15 to 20% of cancers are caused by infectious agents, especially in developing countries. HPV causes nearly all cervical cancers, but we have a vaccine that can prevent it. Hepatitis B and C cause most liver cancers. And again, we have a vaccine for hepatitis B and treatments for C. Number 5 is environmental and occupational exposures. Air pollution is now classified as a major carcinogen. UV radiation from the sun and tanning beds causes most skin cancers. And things like asbestos and radon gas in homes are known risks. These are often preventable through policy, regulation, and simple tests. So let's talk about what you can actually do. These are specific, evidence-based actions. First, physical activity. You don't need to be a marathon runner. Just 150 minutes of moderate activity a week, like brisk walking, can significantly reduce your risk for colon, breast, and endometrial cancer. Exercise helps control weight, reduces inflammation, and regulates hormones. For your diet, focus on whole plant foods. Eat a rainbow of fruits and vegetables. Choose whole grains over refined ones. Limit red meat to no more than 3 servings a week, and avoid processed meats as much as possible. Stay hydrated with water instead of sugary drinks. And of course, maintain a healthy body weight. Even losing just 5 to 10% of your body weight can make a huge difference. When it comes to alcohol, less is always better. If you smoke, quitting is the single most important thing you can do for your health. There are tons of resources to help you, and please protect your skin. Use sunscreen, wear a hat, and absolutely avoid tanning beds. But this isn't just about individual choices. There are huge global disparities. In many low-income countries, the HPV vaccine that could eliminate cervical cancer isn't even available. Tobacco companies aggressively target these same nations as smoking rates fall in wealthier countries. Pollution and lack of access to healthy food disproportionately affect poorer communities everywhere. This is why public policy is so critical. So why isn't prevention a bigger priority? A major reason is economic. Our healthcare systems profit from treating disease, not preventing it. Pharmaceutical companies have little incentive to promote lifestyle changes. And industries like tobacco, alcohol, and processed foods spend billions fighting policies that would hurt their sales. Plus, behavior change is just hard. It is easier for a doctor to prescribe a pill than to counsel a patient on diet and exercise for an hour. But we can overcome this. We need policy changes that make healthy choices the easy choices. We need healthcare systems that reward prevention. And we need to get accurate information out to everyone. So, let me end with concrete steps you can take today. 1. If you smoke, make a plan to quit right now. 2. Schedule any overdue cancer screenings, a colonoscopy, a mammogram, a pap smear. Don't delay. 3. Review your diet. Add 1 extra serving of vegetables to your day. 4. Move your body. Even a 10-minute walk is a great start. 5. Limit alcohol. Try having a few alcohol-free days each week. Remember, 40% of cancers are preventable. You can't control your genetics, but you have significant control over your lifestyle and environment. You can give yourself the best possible chance of living a long, healthy, cancer-free life. The knowledge exists. The science is clear. It starts with knowledge and continues with action. Your health is worth it. Take the first step today. Thank you for watching.